Before using Ranibizumab implant, make sure to read the medication guide provided by your pharmacist. This implant is placed into the affected eyes by a healthcare professional, and the affected eye is numbed before the procedure. Your eye will be monitored before and after placement, and the implant device will be refilled as directed by your doctor, usually every 6 months. To prevent serious side effects, follow your doctor's instructions carefully after the implant is placed, after each refill procedure, and after the implant is removed. Use any eye drops exactly as directed by your doctor. After the implant is placed, keep your head above shoulder level for the rest of the day, and sleep with your head on 3 or more pillows during the day and night. Do not remove the eye shield from your eye until instructed by your doctor, and wear the eye shield for at least 7 nights after the insertion. Do not push on or rub the eye, or touch the implant area for 30 days after the insertion. After the refill procedure, avoid pushing on the eye, rubbing the eye, or touching the implant area for 7 days. If you miss a scheduled refill, contact your healthcare provider right away. After implant removal, keep your head above shoulder level for the rest of the day, and sleep with your head on 3 or more pillows during the day and night. Wear an eye shield for at least 7 nights, and do not do strenuous activities until 14 days after the implant removal. Your healthcare provider should give you an implant card after you receive the implant. Keep the card in a safe place and show it to all your healthcare providers. You may only receive an MRI under very specific conditions if you have this implant. Tell your doctor if your condition does not get better or if it gets worse. If you experience eye pain, blood, or redness on the white of the eye, it's important to tell your doctor or pharmacist. This medication device has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication device do not have serious side effects. However, you should tell your doctor right away if you notice that the implant has moved out of place. It's important to be aware that the medication in this device may sometimes increase the risk of serious, possibly fatal, blood clots, which could lead to stroke, heart attack, and other blood vessel problems. If you experience symptoms of stroke, such as weakness on one side of the body, trouble speaking, sudden vision changes, or confusion, or symptoms of a heart attack, such as chest/jaw/left arm pain, shortness of breath, or unusual sweating, it's important to seek medical help right away. While a very serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or you may report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, or you may report side effects to Health Canada. Before receiving Ranibizumab implant, it's important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had a recent eye infection. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. After receiving the implant, avoid driving, using machinery, or doing anything that requires clear vision until the eye shield can be removed and your vision is clear. Try to avoid rubbing your eye or touching the implant area as much as possible. If you need to touch your eye, be sure to wash your hands first. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, but it is unlikely to do so. However, it's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions when using Ranibizumab 10 mg per 0.1 ml intravitreal implant Soln initial fill needle, as they may affect how this medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of ranibizumab. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Regular medical checkups, including eye exams, are important while using this medication. It's crucial to keep all scheduled medical appointments and consult your doctor for more information. Make sure to take each dose of this medication as scheduled. If you happen to miss a scheduled refill, be sure to get in touch with your healthcare provider immediately to arrange a new appointment. This medication is administered as an implant in the eye, and the procedure is done in a clinic or doctor's office. The device and medication are not meant to be stored at home. It is important to follow your healthcare provider's instructions for the administration of this medication. The benefits of this medication should be discussed with your healthcare provider, including the daily dosage and optimal timing for administration. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.